So, in terms of what you can do in a non-specialist setting, or even if you're in a specialist setting, you might work in mental health or community health or even an alcohol and drug treatment program. Um, you will almost certainly have people in your client group who use alcohol and drugs in risky or harmful ways. And people often don't disclose if you don't ask. So, the most important thing to do, if you only do one thing, is to do a good assessment and early identification of problems. Um, so, we're thinking about asking about tobacco, alcohol, and other drug use in your general assessment. You should ask about it like it's normal. So don't say things like, I'm really sorry, I have to ask this. I ask this of everybody. You don't have to tell me. You don't need to do any of that, because the clients don't know that you feel, if you feel uncomfortable about asking about sensitive topics like alcohol and drugs. So I often hear people, I have friends in sexual health, for example, who ask all sorts of very detailed questions about sexuality and sexual activity. And they'll say things to me like, how do you ask about alcohol and drugs? It's so personal. So everyone in their own area might think other things are more personal than the things that they're asking, but the clients don't know any different. So you should just ask like it's a normal part of assessment. You don't have to apologize for it. And one of the if you don't do anything else, one of the key strategies is to use what we call a top high approach when asking questions. So how often do you drink alcohol? Is it every day? So we're saying the maximum amount, so they can go, oh no, hang on, no, not every day. I probably drink about 5 days a week. But if you said, how often do you drink alcohol? So like 1 or 2 days a week, subliminally, subconsciously, you're kind of saying to them, well, 1 or 2 days a week's normal. And so they're going to go, yeah, only 1 or 2 days a week. So go for a top high approach. Don't apologize for it. Just ask the questions as if it's part of normal assessment. The main things to ask about are patterns of use and readiness to change. They're the two most important things. And just a reminder about the stages of change model, if you haven't heard of that. I'm not going to really go through this in detail, but just reminding you, if you want to go have a look at it again, and also a reminder that people kind of shift between those, not in this nice cyclical way that appears in this diagram. They might go from contemplation to action, and then back to preparation, and then back to pre-contemplation. So need to just keep an eye on that. The other little technique that I just want to talk to you about is what is called ask, provide, ask, which seems obvious. So the framework is ask what they already know about changing, provide some information about cutting down or stopping or treatment, and then ask what their thoughts are about the information. So for an example, you might say, what changes have you already considered making? And they might list a few things. So I could give you some ideas along those lines. Would you find that helpful? And then give them those ideas. And then you might say, so how does that sound to you? Do you think you'd be able to try any of those? So that's like an approach, a motivational approach to help work out which treatments are going to be most palatable for your clients. And the very last thing I want to talk about really is just how to refer someone for specialist treatment. If they have a mild or moderate problem and you already have a relationship with them, I would encourage you just to give it a go yourself. Even if you're not a specialist alcohol and drug practitioner. We know that brief interventions are effective, especially for alcohol. And we know that really, if you're in a therapeutic mode, just about anything you do will be helpful. And if you monitor outcomes and over a 3 month period, so remember that that sweet spot of 3 months, if you monitor outcomes over a 3 month period and they're not improving, then I would think about referral. But even before that, because the alcohol and drug sector is very underfunded and there's very long waiting lists in a lot of treatment types, there's a kind of step between doing it yourself and referring out, which is doing it yourself with some support from alcohol and drug specific supervision, for example, so that you can offer some therapeutic treatment yourself. And actually, the biggest difficulty that I see that clinicians have that I supervise is really just keeping to the treatment plan for long enough for it to work. So drug use often means that some clients are a bit all over the place, especially if they're still using. And our job is really to kind of smooth off the edges and keep them along the path. They might kind of walk off the edge of the path for a bit and then kind of bring them back. You can bring them back in. But if we keep kind of switching strategies and going down different paths just because we think something's not working, it can actually make things worse. So, yeah, if you just tried to stay on the path for 3 months, monitor that, and then step up from either to supervision or to referral after that. That is the most effective way to respond.